Good afternoon. I am Dr. Raj Kumar, Interventional Cardiologist from KIMS Hospital. I'm presently working as a consultant cardiologist at Kurnool. Today, I'm going to talk about coronary artery disease in young adults. Coming to this topic, as we all know that India is a young country in which most of the population belongs to young adults, such as less than 45 years to 50 years, constitute about 65% of our total population. So anything which affects this younger generations has a major impact on social and economic status of country. So coming to by definition, young adults include the people who are aged below 45 years according to India, whereas according to Western countries, younger adults include populations who are less than 55 years of age. So we consider as young adults as less than 45 years in our country. So the various risk factors which are associated with this coronary artery disease in young adults, I am going to discuss today. And coming to the various statistics, uh, coronary artery disease occurs little bit earlier, that is 1 decade earlier in India compared to the Western countries, and there is high risk of 2 to 3 times higher risk of getting coronary artery disease in young adults in Asian ethnics, particularly India, compared to the foreign countries. And we all know that various risk factors which are divided into modifiable and non-modifiable. Among them, modifiable risk factors according to Framingham risk score, which calculates the risk of getting coronary artery disease in different populations, in which modifiable risk factors includes particularly diabetes, hypertension, smoking, dyslipidemia, and obesity as the major risk factors, and minor risk factors includes lifestyle changes, sedentary lifestyle, and consumption of junk food. But non-modifiable risk factors include gender, age, and family history. So, people who are having their first degree relatives, that is parents or siblings, who got coronary artery disease at younger age, that is in males if it is less than 55 years, and in females less than 65 years, are higher risk for getting premature coronary artery disease at younger age compared with patients, people who do not have family history of coronary artery disease. And I did my DM cardiology in Kurnool Medical College. During my DM course, me and my colleague did a study on same topic, that is coronary artery disease in young adults. We could observe various risk factors associated apart from the conventional risk factors which we observed, that is diabetes, hypertension, dyslipidemia, and other things. We could observe other non-conventional risk factors which are associated with coronary artery disease in our local area around Kurnool. So such as lipoprotein A levels, high levels of lipoprotein A, homocysteine levels, and hyperhomocystinemia, and high levels of HSCRP levels. So these are also has to be considered as the risk factors, and we have to investigate these risk factors among the patients, young adults who present with coronary artery disease. Coming to the various statistics, that is, we all know that hypertension is the most common risk factor for coronary artery disease, and coming to cardiovascular risk factor, cardiovascular deaths due to cardiovascular disease constitute about 25% of the all deaths. Previously, before 1 to 2 decades earlier, most of the deaths in India were not due to communicable disease like tuberculosis, infections like malaria, other things, diarrhea, etc. But from past 1 decade, the deaths due to non-communicable risk factors like coronary artery disease, diabetes, hypertension has progressively increased in number due to westernized lifestyle, sedentary lifestyle, and stressful life, and consumption of junk food, and these are the major risk factors for getting various coronary artery disease and cerebrovascular accident at early age compared with previous days. So coming to hypertension, statistics show that around 30 to 35% of our general populations are hypertensive, and it is the most common risk factor for cerebrovascular accident and also cardiovascular events. So, and in my study, it accounts for 10 to 15% of the all young adults who presented with coronary artery disease and admitted with myocardial infarction. This is the statistics. And coming to diabetes, we all know that WHO has announced India as the cardio-diabetic hub. So, as the number one number of patients of diabetes are recorded in India. So, patients in my study, patients with diabetes present with coronary artery disease in young adults were around 18 to 20%. So, it is also has to be taken care. And diabetes in general causes dyslipidemia. Due to diabetes, dyslipidemia includes high levels of triglyceride levels, higher total cholesterol, and lower levels of HDL levels. In the Indian ethnic group, the dyslipidemia which generally is seen includes high triglyceride levels and low HDL levels, which is similar to the diabetic dyslipidemia. So, due to these lower levels of HDL and higher levels of triglycerides and total cholesterol, patients are coronary arteries are plaque formation in coronary arteries is more frequent, and so they will be presenting with rupture of plaque due to various risk factors like smoking and due to stressful events and other things. And few of the patients presenting with cocaine abuse and other illicit drug consumption, they present with this type of rupture of plaque in the coronary arteries, leading to the closure of coronary arteries and presenting with acute coronary syndrome. And other risk factors like smoking, which constitute about 70 to 80% of the patients who presented as inpatients with coronary artery disease in young adults in my study. So, consumption of tobacco in the form of smoking and also other forms like chewing tobacco has also lead to the coronary artery event, as it causes inflammation in the coronary arteries and also rupture of plaque, which is observed from the birth of day of birth till death. So, due to the rupture of these plaques due to smoking, leads to the formation of thrombus, which cause occlusion of the coronary arteries and leading to the acute coronary syndrome and presenting with ST segment elevated MI or non-ST segment elevated MI. So, consumption of more than 20 cigars per day increases the risk of 2 to 3 times risk of getting coronary artery disease than compared with non-smokers. Even one cigar per day is also considered as risk for various diseases like cerebrovascular accident, coronary artery disease, peripheral artery disease. So, we have to educate the younger generation to quit smoking as early as possible and avoid smoking. Other risk factors like obesity, we all know that obesity is considered as BMI with the calculation of BMI. If it is 25 to 29.9 kg per meter square, it is normal level, and above 30 is we consider as obesity. So patients who are obese 30 to 35, there are moderate risk for getting coronary artery disease, and above 40, there are high risk for getting cardiovascular events. As the obesity causes increases the abdominal fat, increases the lipid levels, dyslipidemia, they are more prone for getting diabetes and they are more prone for getting hypertension. So obesity has to be taken care as early as possible. Another minor risk factors include sedentary lifestyle. We all know that due to westernization and industrialization in our country, most of the adults are getting jobs with the high risk, high stressful events with poor sleep and consumption of junk food with trans fats, higher trans fats in present in fast foods, and also trans fats is one of the risk factor for getting coronary artery disease, as it leads to dyslipidemia and increased progression of atherosclerotic plaque in young adults. So, and minor risk factors, I have already told, and non-conventional risk factors like HSCRP levels is recently picking up as a marker for early detection of coronary artery disease, and patients with 1 milligram per liter is not 1 to 1.3 and more than 3, we will consider as various risk factor. If it is 1 to 3, it is moderate risk, and greater than 3, higher risk for getting coronary artery disease. So we have to check this CRP levels, and hyperhomocystinemia is one of the thing which generally observed in Indian and Asian countries, where higher levels of hyperhomocysteine levels causes increased thrombogenicities in coronary arteries, various arteries, and it is one of the cause for coronary artery disease in young adults, which in our study has observed in around 60 to 65% of the patients. So, a patient presenting with young adults presenting with coronary artery disease, if it doesn't have any conventional risk factors like diabetes, hypertension, smoking, then we have to check for non-conventional risk factors like apolipoprotein levels, homocysteine levels, HSCRP levels, and other minor rare causes like coronary artery dissection, aneurysms of coronary arteries, and protein C, proteinase deficiencies. These are all the various risk factors for getting coronary artery disease. And in my study, males constituted majority of the coronary artery disease patients. It accounts for 75 to 80%, and females constitute about 20%. Particularly in females, OC pills during their early age, consumption of OC pills in younger age and long duration of consumption of OC pills leads to dyslipidemia, and which in turn cause coronary artery disease in young females. And other risk factor which we observed in young females are coronary artery dissection, which is the rarest of the thing which we observed in our study. Patient presenting with coronary artery dissection in peripartum period is common. So we have to keep in mind while investigating a patient with coronary artery disease in young adults. And the things which we have to the genetic part, I'm going to talk about genetic part, that is as Asian Indians are more risk for getting cerebrovascular accident 10 years earlier than the Western counterparts, as the genes, various genes which are responsible for getting coronary artery disease includes the genes which metabolize the lipids, that is apolipoprotein A and PCSK genes. These are all due to mutations in our genetics. They are Indians are more prone for getting dyslipidemias, higher triglyceride levels, lower HDL levels. HDL, which is good cholesterol, is lower in Indians compared to Western counterparts. So, and other things like homocysteine gene mutation causing higher levels of homocysteine, leading to increased thrombogenic capability in coronaries and other parts, presenting with acute myocardial infarction. So, preventive aspect, as we all know that we can't avoid coronary artery disease in young adults, but we can decrease the prevention. We can prevent by getting coronary artery disease by detecting the conventional and conventional risk factors at early age. We have to start screening our patients at an early age, that is by 25 years, whether patient is a general screening, whether such as diabetes, hypertension, dyslipidemia, and we have to educate the patients who have family history of coronary artery disease in their family members, that is male, if the male is their father is less than 55 years who has coronary artery event, or mother is less than 65 years and have cerebrovascular accidents, then these patients, we have to educate them that they have to be stringent with their regular checkup, and lifestyle habits we have to educate them. And coming to diabetic and hypertension screening, and we have to educate by avoiding smoking, whether the tobacco smoking or tobacco consumption in various forms. And we have to tell them that consumption of various illicit drugs like cocaine and other things may also cause coronary spasm and coronary artery disease. And we have to educate about consumption of vegetables and fruits which have high fiber diet. And due to consumption of higher levels of vegetables and fruits, there is chance of decreasing the rate of coronary artery events in young adults. So we have to stress upon the education. We have to educate the dietary habits, and we have to tell about the consumption of trans fats is one of the risk factors for coronary artery disease. We have to educate about this. And coming to exercise and sedentary lifestyle also has many risk factors of like cerebrovascular accident and cardiovascular events. So at least 30 minutes of aerobic exercise per day or 150 minutes per week is essential for preventing coronary artery events or from getting diabetes, hypertension, and other obesity, other risk factors. And other things, in my study, around 65% were hyperhomocystemic patients, and 10% was patient were diabetic, 18% to 20% were hypertensive, and 75% were smokers. And there were family history of around 35% of the patients was having family history. So we have educated about the various preventive measures to them. And among the angiographic picture, most of the patient presented with LAD, left anterior descending artery, a single vessel disease in around 50%, and multiple vessels artery was observed in around 38% of patients, and patients were normal coronaries was observed in 25% of patients. So getting coronary artery event in young adults is not, it normally it accounts for less than 2%, but recent statistics shows that as the number of diabetic, hypertension, and other risk factors in younger patients are increasing, so the chance of getting coronary event in a younger population is also gradually are increasing. So better to avoid, better to detect the conventional risk factors early and prevent them from getting major coronary or cerebrovascular events. Thank you. Okay. Other things, we have to educate about the lipid levels. That is, after 30 years, once a while, that is once a 5 years, they have to get lipid profile checkup, and regular yearly once hypertension, diabetes, and BMI checkup has to be done, so that we can detect early and we can prevent it. And we have observed in my general OP that if I detect a patient with who is hypertensive and I start prescribing, they will be unwilling to take the medication, as they are telling it has to be continued for lifelong. But early detection and treatment is the key to prevent major cardiovascular and cerebrovascular accident. So I request everyone to follow this basic exercise, consumption of vegetables and fruits, in increase their consumption of fruits and vegetables in their daily activity, and avoid sedentary lifestyle changes, and avoid high consumption of trans fats, which is present in case of fast foods, and repeated eating of the oils which used for cooking, and consumption of salt less than 5 grams per day is essential, as it causes increase number of increase amount of salt cause hypertension in younger age group. Um, and we have observed in our study, we have observed around 10 to 15 patients dying with coronary artery disease like major attack segment elevated MI, and it has a lot of social and psychological impact and their family members, and it will be it will be burden. It is financially they will be a fatal blow to them. So it is better to avoid these events by detecting the various risk factors at early age. And diabetes is observed. uh, Generally, diabetes statistics shows around 10 to 15% of the Indians are diabetic, and in rural population, in urban population, and 3 to 7% in rural population. So we should not neglect the conventional risk factors like diabetes and hypertension, and detection in early age around 25, and start treating and following them regularly, so that they will not be landing up with uh, high sugars levels and hypertension, presenting with cerebrovascular accident or stroke or peripheral artery disease. And in various statistics is shown that around 9 lakh Indians deaths in 9 lakh Indians die per year due to various cerebrovascular accidents and cardiovascular events. So it forms around 25% of the total deaths in our country. And most of the coronary artery disease patients presenting with uh, age group, different age group, 50% constitute about less than 50 years of age, and 25% of patients are less than 40 years of age. So younger population getting cerebrovascular accident or cardiovascular events is very much uh, major health issue in our country. So early detection and prevention of major attack is the key. Topic, anything. We all know that coronary artery disease occur due to erosion of plaque or rupture of atheromatous plaque, erosion or rupture. This erosion occur even if the plaque is minor plaque, whereas rupture occurs when major plaque uh, due to various factors like smoking, which cause inflammation of arteries and cause coronary artery spasm and increase in the prothrombogenic levels like fibrinogen, other things, which cause increased thrombus formation and causing block to the coronary arteries, and patient may present with coronary major chest pain, sweating, or breathlessness while doing work. Yeah, completely.